Hello, everyone, and welcome back to our podcast. This is our second episode. We're a little bit less nervous. Last episode, we talked about what a healthy mouth is, and of course, what happens if you lose your teeth and what are the options to replace them. So we're going to dive into a little bit more implant treatment this time, and what are the options in incorporating implant with other prostheses.
Before we get too far, last episode you were talking about using implants for partial dentures. Let's talk about that and how you would do that.
Very good question. So individuals who have full dentures or partial dentures, if they notice, of course, some of the dentures are loose, they kind of wobble, especially on the lower one, there's really no stability. So they can't really bite into things and things are moving around. So even if you notice with individuals who have partial dentures, you'll see hooks that are hooked around the natural teeth to hold the partial in place. So that puts a lot of strain on the teeth. And of course, after some time, the anchor teeth that are hooked to, they'll be lost. So you can actually use implants underneath partial dentures or underneath full dentures to be able to anchor the partial denture or the full denture to kind of stabilize it so they can function better and to preserve the bone, actually. So those are the different ways you can use implants.
And they're able to eat better as well?
Absolutely. Much better, much more stable. They'll be able to bite better. And of course, most people who have dentures or partial dentures can actually be using these adhesives in their mouth to be able to kind of hold it in place. They can eliminate that by having implants that are underneath to hook it to.
How many implants are needed to be able to support a partial versus a full denture?
So that every case is different. We would have to do a full evaluation to see how many teeth are missing, how is a partial denture designed. But on a full denture, you do have options of anywhere from having 2 implants right in the front that hooks underneath, up to 4 to 6 implants that can actually hold a denture that doesn't have a roof of the mouth. Most people who wear dentures realize that, of course, the roof of the mouth is covered to create a suction for that to stay for the top. So the roof of the mouth is usually a covered area with a full denture. So you can eliminate that by having multiple implants placed and having sort of a horseshoe type of a denture that fits on top and is much more stable. And that also can be fixed or removable for a denture. Partial dentures, again, every case is different. We would have to see the design, how many teeth are missing, where we can locate the implants. But usually anywhere from 2 to 3 to 4 can stabilize the partial or full denture nicely.
Great, Dr. T. Now let's talk about implant bridges.
Implant bridges. So as we talked about conventional bridges, you have 2 teeth on the side that you cut down to get a bridge across. If you have multiple teeth missing in the back or in the front, you don't have to replace every single tooth with an implant. So let's say you have 3 missing teeth. You can get 2 implants basically farther apart, and you can bridge it across with 3 teeth, just like a natural or a normal bridge would be. And again, that's fixed. Again, it does have its concern of not being able to floss underneath like the other teeth. But of course, you can minimize the number of implants you place, which reduces the cost to be able to get more teeth in that area. Implants are much stronger than natural dentition. Sometimes we can actually attach 4 teeth to 2 implants in some cases where you have good bone, where you can put in nice size implants and everything else.
And as long as you're getting in there, flossing, keeping good hygiene, you should be able to keep that bridge for a long time.
Absolutely. I think everything in life is about maintenance. Your car needs maintenance. Your mouth needs maintenance. We eat every day. It's the most wonderful thing we have that we can do. So if you don't maintain, if you don't take care of it, everything will fail. No matter you have the best dentistry in your mouth, the best implants and the best surgeons, everything can fail if you don't take care of it.
All right. Thanks for the great info. Let's go ahead and talk about Let's go ahead and talk about materials of the dental implants.
Materials. So, of course, probably 99% of the implants that are used throughout the world right now, maybe less, it's titanium alloy, type 4 titanium. It was basically found by accident by an orthopedic surgeon in Sweden. They were using titanium screws, to screw in plates and everything else in legs and, of course, the knees and hips. And they could not get these screws out. So they found out that, of course, the body just loves attaching itself to titanium. So titanium is number one, of course, product that's used to make implants. We do have also zirconium implants. They're a newer product. They're actually white looking. They're very strong as well. So I think eventually zirconium implants are going to take over the titanium implants, but it's still fairly new. And there's a lot of research that's being done to be able to have long-term data before we can start using it exclusively.
What would be the reasoning for choosing the titanium versus the zirconia?
The zirconium. So initially, when the reason this came about is, of course, titanium implants have a color. They're usually grayish looking or silver looking. So as you place that into the jawbone and you have gum tissue that covers it, sometimes that darkness can actually come through, so you can see some of the dark hue. Honestly, I don't know much about the zirconiums to be able to talk about it, but I would say that's a reasoning zirconium implants came about to be able to utilize them, was more of an aesthetic issue. But they've had concerns with them because it's very limited as far as being able to replace crowns on top, for example. But now that's becoming much, much better as time goes. So again, there's a lot of research still being done about that product, but it's available to individuals out there, especially individuals that may have titanium allergy, which happens extremely rare. It's rarely, but if they do have that, then you can use zirconium implants.
Hey, Dr. T, so you mentioned that implants are mostly titanium. Does that have any effect on any alarms, like in the airport, anything like that?
Very good question. Absolutely not. No problems at all when you go through the airport. It's not going to set off any alarms at all. And if you need to have an MRI done, not an issue whatsoever.
How successful are implants?
Implants have a very high success rate. Of course, the average percentage is anywhere from 95 to 97%. Of course, determining, having good bone, good oral hygiene, that all plays in the factor, but a very high success rate.
How long do implants last?
Implants they're meant to last a lifetime, of course, but nothing really lasts a lifetime. It's how well you take care of it, how well it's placed, the position. The engineering behind implant placement is the most important thing when you place an implant. It's not just simply placing a screw in your jawbone and you're good to go. So there's a lot of factors behind the scene that needs to be taken care of before an implant is placed. But I would say I've seen implants in somebody's mouth been there for 40, 45 years, but I've also seen implants that last for 5 years and they fail, but you see why. The patient doesn't clean, doesn't take care of it. There's other factors that involve. But implants are meant to last a lifetime if it's very well taken care of.
You mentioned building bone.
Bone loves titanium, so we need to have the bone to be able to place the implant. But of course, when patients come in and they have a missing tooth or many teeth for years, the bone has diminished. Very little bone available, height or width in all three dimensions. So we need to make sure we have enough bone. So the technology has come to the way that we can actually build bone. We're not 100% there, but we can do extensive work to build bone and get you back to get you implant in your mouth. And building bone, we have different procedures, any minimally invasive up to very extensive procedures that are available to build the bone so you can actually get the implants.
How do you indicate whether a patient has enough bone? Do you just look in their mouth?
Excellent question. Yes, of course, a clinical exam when you actually see somebody in the mouth. Of course, we do have 3D exams now, which is a CT scan. So the 3D scan, actually, we do have it in the office. So the patient goes through, it's like a regular x-ray, like the Panorex that people may have been used to, that the picture goes around. Mm-hmm. It does the same thing, but you can actually see the jawbone in 3 dimensions. So you can see where all the bone is, what the densities look like, where all the nerve endings are. So all the important structures for us to be aware of to place implants. So that's one of the ways that we know. And of course, looking in the mouth, it's not just having the bone. The bite is important. The location of the teeth is important. Having enough gum tissue, that's important. There's so many different factors that play into placing an implant, but to be able to evaluate how much bone you have, we need to do some x-rays and do a clinical exam.
And with building the bone, what do you use to do that? Do you take the bone from the patient?
Very good question. So we used to take patients' bone, actually take it from their hip mm-hmm. or other areas in the body. And of course, even now we take it from other places in the jaw to place the bone. But there's, with all the new products that are out there right now, we are able to build bone without using the patient's bone. Basically, although, patient's bone has been the best or the gold standard to be able to build bone, to place implants, but there are ways to build bone without using the patient, because of course you have to go do a second surgical site to go to their hips or even their jawbone, and it's just more painful for the patient. So we try to that's been minimized extensively by having new products out there to build the bone for you.
And what are those products?
We have many different types of bone available depending on the site we're going to be building the bone. And that's just basically comes in either particle form or actually good sized chunk bone that we actually kind of screw into the jawbone to build the bone. On top of that, of course, we have other products that we place in there. The newest products out there are what we call bone morphogenic proteins. These proteins are basically naturally made in our body, but of course we're able to harvest it and get it into a little tube and be able to use that, or a vial, be able to use that and incorporate that within the bone. That and the function of that protein is to bring the cells that make the bone to that area, make the bone for you. It just speeds things up and makes you actually have a nice bone in that area. So,
how safe is the bone that you use if it's not the patient's bone?
Very good. So if it's not the patient's bone, the options that we have is donor bone from other humans, or what we call xenograft, which comes from other species like a cow or even pigs. But the most that we use for these procedures is cow bone. Cow bone has a great tendency to stay in the area, has a good density. There's no chance of disease transfer. Nobody's going to get mad cow disease. But it's a great product out there. Even with human donor, we use that as well sometimes to build bone. One of my mentors actually did a great study that what they did is they go, well, how do we know that this bone is actually sterile when it places in patient's mouth? So they took the bone and actually spiked it with HIV cells. So they actually made that bone disease before it went through the process, before it came back into a vial, before we use it. And for the first pass, which was the defatting pass with some acid, nothing could exist. Basically, nothing could survive. None of the viruses or bacteria or anything like that could survive. None of the disease could transfer. The HIV cells that were basically injected into the bone, none of them were in existence. So there is no chance of disease transfer. It's basically dead product. What it is just collagen, which is the basis of our body. And it just acts as a scaffold for your body cells to come to the site and make your own bones. So for example, if you build bone in a site and you have to go back in the same site in the next 3, 4, 5 years, you'll notice that all that bone is pretty much turned over into your own bone. None of that really stays in there. It's not like a heart transplant or a kidney transplant. That's live tissue. This is going to wrap up for our episode 2. Thank you so much for listening. We really appreciated you joining in. Next time, we're going to talk about a little bit more in detail about the procedure and what to expect when you go get a dental implant done. Thank you again.
Thank you. Thank you all for listening to the Healthy Mouth podcast. As a reminder, the information we provided in this podcast is for educational and information purposes only, and it is not to substitute medical advice, diagnosis, or treatment. Please check with your family doctor or professional advisor before using any information provided in this podcast.
The Healthy Mouth podcast is co-hosted by Leah Applegate and Dr. Paul Towfighi. Our executive and technical producer is Johnny Flores, and our video producer is Aaron Zaragoza. A new episode is available every other Thursday.